Today, I'm going to explain the differences between an anxiety attack, a limited symptom attack, a panic attack, and how panic disorder develops. Then I'm going to give you some insight on what you have control over and what you don't, and how to best treat these symptoms so that they don't snowball into something more debilitating. If you're struggling with anxiety symptoms, you may feel overwhelmed sometimes, helpless, or even confused about what to do and where to begin. So first, let's talk about an anxiety attack. Now, all mental health conditions are diagnosed according to a manual called the DSM-5 TR, and that means the latest text revision came out in 2022. Now, the DSM does not use the term anxiety attack, but that phrase is often used by the public to mean a period of time where you're feeling highly anxious. And that can encompass a wide range of symptoms that, revolve around excessive worry and apprehension. Let me give you an example. Imagine Sandy. She's a university student who's constantly worrying about her academic performance. She finds herself unable to concentrate during lectures, has trouble getting to sleep, has muscle tension, maybe feels a little bit jittery. But the anxiety goes away when the stress of this semester is over. In Sandy's case, her self-imposed expectations may be the culprit here, and therapies like cognitive therapy or cognitive behavioral therapy like ACT therapy may help challenge her negative thought patterns and irrational beliefs, and possibly incorporating a daily stress management routine would help improve her coping skills. Now let's focus on panic attacks. The DSM-5 defines a panic attack as periods of intense fear or discomfort in which at least 4 of the following 13 symptoms develop quickly and peak within 10 minutes. The 13 symptoms include palpitations, a pounding heart or accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath or smothering, feeling of choking or a lump in the throat, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, derealization or depersonalization, fear of losing control or going crazy, fear of dying, numbness or tingling sensations, and chills or hot flashes. To give you an example, Marco is a young professional working at his first job after graduation. He's in a meeting where he has to give a presentation to his boss along with other colleagues. He suddenly experiences a pounding heart, sweating, trembling, difficulty catching his breath, and this impending sense of doom while waiting to give his presentation. His thoughts are, "Oh no, am I having a heart attack? What's going on? Am I going to pass out?" His symptoms reached their peak within minutes. Marco experienced a panic attack. You may have heard the term limited symptom panic attack or limited symptom attack. And this also is not an official diagnosis in the DSM, but limited symptom attacks are very common, especially in people with other anxiety conditions like agoraphobia, social anxiety, and even depression. It simply means that people have less than these 4 out of the 13 symptoms that I reviewed. Now let's move on to understanding more about panic disorder. Not everyone that has a panic attack develops panic disorder. In fact, 2 to 4% of people develop panic disorder, whereas 23% of the population has experienced 1 or more panic attacks. Panic disorder is defined as recurrent, unexpected panic attacks, along with being concerned about them or changing any behaviors due to having panic attacks, or worrying about the possible implications of panic attacks. And the worries might be things like, what if panic causes me to have a heart attack? What if my derealization symptoms make me go crazy or get worse? Research suggests that panic attacks are often triggered by a combination of genetic and environmental and psychological factors, including one's level of anxiety sensitivity. Anxiety sensitivity is the degree to which someone misinterprets anxiety symptoms as dangerous. Now, to illustrate how the panic disorder is developed, and most importantly, what you have control over, let's take a look at the panic cycle. First, something happens. We call that a trigger. Now, the trigger can be anything. You could have had a fearful thought. You could have noticed a bodily sensation like a palpitation. Or maybe you're giving a speech, or you have to drive over a bridge, or you drink too much caffeine, or you see the door on an airplane close. I mean, the trigger can be almost anything. Triggers happen. It's just part of life. Next, you feel anxiety symptoms. It could be one or it could be a few of the 13 physical symptoms that I listed. This isn't a panic attack yet. It's just a symptom. These symptoms are part of your nervous system's anxiety response. Claire Weeks in the 1970s, she referred to those first symptoms as first fear. It's just your body responding to the trigger. Now, I describe the first fear as that kind of instantaneous spike of adrenaline that you feel when maybe somebody cuts you off when you're driving. You might feel like this quick whoosh of adrenaline, but then you quickly realize, everything's fine and you're kind of back to normal. But what comes next in the panic cycle is important. This is when you misjudge the physical symptoms as dangerous. You think, oh no, and then you might catastrophize about what you just felt and make a misinterpretation that it was something threatening or harmful. Claire Weeks would refers to that as the second fear. That, oh no, includes fearful thoughts like, oh, I might die, I might go crazy, I might lose control, I might embarrass myself, I can't handle this. Here you're catastrophizing about what you're experiencing, and those thoughts increase the activity in your amygdala and further activate your nervous system's fight or flight or freeze response. Now more adrenaline is pumping into your bloodstream and your heart rate and breathing rate both increase. That, oh no, misinterpretation or misjudgment that something dangerous is happening is where the real panic cycle begins. When the brain receives the message that you're scared and that you don't want to have these sensations and that you wish they would stop, even more adrenaline is released into your bloodstream. Then, unfortunately, you feel even more anxiety symptoms. Now, the next thing to come on the panic cycle is that you try to do things to calm yourself. You might try to do breathing methods or relaxation methods or essential oils or tapping or drinking or eating certain things. You might avoid being alone or doing certain things. The list of safety and avoidance behaviors, they're endless. And any of these behaviors may calm your anxiety in that moment, but all of them reinforce the panic cycle and train your brain to actually fear anxiety sensations. Your thoughts and your safety and avoidance behaviors send messages to the brain that, boy, those anxiety sensations must really be dangerous. Good thing you did all those things to calm down and avoid those triggers. Make sure you do that the next time. And oh, by the way, because that was such a horrible experience, I'm going to be hypersensitive to those symptoms and sensations, and I'm definitely going to alert you big time next time I notice any of those symptoms. And hey, I'm going to even alert you when you're not anxious. I'm going to alert you if I notice that. So in essence, you're not only training your brain to fear anxiety symptoms, now it's going to be hypersensitive to feeling them. And the brain can link or pair those sensations to your fear response. And that means that when one happens, so does the other. When it notices your heart rate increase, even if you are anxious, boom, now the neurons are paired and linked, and you'll automatically activate your fear response. Now, looking back for a moment at the panic cycle, you have no control over your triggers. Life happens, and you never want to try to avoid the triggers. And you have no control over your initial sensations. That's your first fear. That's automatic. You do have control over how you judge or interpret what you're feeling. You can change that, oh no, to, oh well. And you can stop catastrophizing, and you can learn to allow and welcome the anxiety symptoms to be there. And you have control over those safety and avoidance behaviors as well. But let's talk about these anxiety sensations or symptoms. Most of these symptoms are very uncomfortable. Some of them are even painful, but there's a big difference between uncomfortable and something being harmful or dangerous. Nothing about panic attacks or panic disorder is dangerous. The symptoms are not harmful or dangerous. I have a PDF that goes into detail about what happens in your body when you feel anxiety sensations, and I'm going to leave you a link in the description below. It really helps to understand the physiology of anxiety in the body. Now, for people that suffer with conditions like panic disorder, agoraphobia, health anxiety, OCD, and other anxiety disorders score very high in a trait called anxiety sensitivity. Anxiety sensitivity is the real culprit in panic disorder, and it means that you're interpreting anxiety sensations as dangerous when they're not dangerous. People that race cars or ride roller coasters, they can experience all the same symptoms that you experience during a panic attack. They can have increased heart rate, they can have increased breathing, feel sweaty, dizzy, nauseous, off balance, DPDR, all of it. But instead of feeling threatened by those symptoms, they interpret their whole experience as exciting, awesome, thrilling, and they want to do it all over again. It comes down to how you interpret what you feel. Now, the last thing you want to do when you're feeling these symptoms is to begin avoiding triggers or start doing things to calm yourself or make yourself feel safe. If you avoid the triggers like driving or traveling or being in crowds or being alone, you can develop more debilitating conditions like agoraphobia. And if you begin to try to calm yourself down by doing relaxation methods or breathing techniques or tapping or meditation, during those episodes, you're sending signals to your brain that you really are in danger and you must do something to not feel that way. It reinforces that misinterpretation again, that panic symptoms must be dangerous, and it reinforces the panic cycle itself. Just to be clear, it's helpful to practice breathing techniques, meditation, relaxation, or whatever stress management tools that you like, just not during an episode of high anxiety or panic. Now, I borrowed from experts like Claire Weeks and Reed Wilson, and I developed a method of helping people to move through high anxiety and panic that changes people's lives. It's called F.A.C.E, and I left you a link to the PDF that explains the technique in the description below. Now, for people that have developed severe panic disorder, their brains have likely paired or attached different bodily sensations directly to their fear response. If you can relate to that situation, sensitivity reduction exercises like interoceptive conditioning can be helpful for you. If you're interested in learning these techniques, I walk you through this treatment step by step in my panic course at PaigePradko.com. Now, anxiety attacks, limited symptom attacks, panic attacks, and panic disorder represent a continuum of emotional experiences. Through understanding what you have control over and by using evidence-based treatments, you can navigate these challenges and truly get your freedom and your life back again. Until next time, I'll see you in session. Take care. Bye-bye.